Hello, this is Dr. Rifat Aliman. I'm one of the founder and mentor of the Basis Care team. In our today's video, we'd like to share some approach that how can we differentiate between different causes of collapse. So in MRCP Basis exam and also other exam, it may present in different form like collapse, faintness or blackout. So you have to clarify the symptom first. So if patient complains of like blackout or collapse, we have to first think of that whether the consciousness was impaired or not. If there is complete or partial loss of consciousness, then we can think of syncope, epilepsy, hypoglycemia, vertebrobasilar transient ischemic attack. In case of collapse without affecting the consciousness, then we can think of transient ischemic attack, falls, and psychogenic pseudosyncope. So if we want to broadly divide the syncope in different types, there are mainly three types of syncope, that is reflex syncope, cardiac syncope, and syncope due to orthostatic hypotension. Reflex syncope can be due to vasovagal syncope, like in case of emotion, fear, pain. In case of situational syncope, in different situations like cough, micturition, or post-exercise, and there is also carotid sinus syncope. In case of cardiac syncope, there we can think of like different types of arrhythmia, like bradycardic arrhythmia and trachyarrhythmia. Structural heart disease like HOCM, valvular heart disease, and also pulmonary embolism. And in case of syncope due to orthostatic hypotension, we can think of primary autonomic failure that can occur in multiple system atrophy or Parkinson disease, secondary autonomic failure like in diabetes mellitus and amyloidosis, drug-induced hypotension in different drugs like vasodilators and diuretics, and other volume depletion like diarrhea and vomiting. So now how should we divide the symptoms to approach a collapse? So we have to divide the collapse episode into three parts, that is symptoms preceding, during, and after the event. So in case of vasovagal syncope, before the syncope there will be some prodromal symptoms like flashing, lightheadedness, nausea, and blurring of vision, which can be precipitated by hot environment, prolonged standing, and anxiety. And during the episode, there will be transient loss of consciousness, and we might find some collateral history like pallor, which can be observed by others, and usually which lasts for a few seconds, and there will be rapid recovery after the event. In case of carotid sinus syncope, during neck movement, shaving, and wearing a tight collar, usually this type of syncope happens. And it can happen also in situations like during coughing, defecation, and micturition. Cardiac syncope, in case of cardiac syncope, usually there is some preceding history like chest pain, shortness of breath, palpitation, and during the syncope, there might be some exertion, like which commonly happen in HOCM and aortic stenosis and other arrhythmias. And after the cardiac syncope, usually there is rapid recovery, and obviously there might be some history of cardiac. So in case of syncope due to postural hypotension, it usually happens during standing or changing the posture. So you have to ask about the cause. So if collapse is associated with some seizure, then you have to ask before the event whether there is any aura, any precipitation by flashing of lights, sleep deprivation, alcohol, and during the event whether there is any collateral history of loss of consciousness, jerking of the limbs, tongue biting, frothing at the mouth, rolling of the eyes, loss of control of urine and feces, and repeated head turning to one side. And in case of absent seizure, there might be the patient may complain of repeated eye blinking. And we have to obviously ask about whether there is any injury happened or not. And usually after the seizure, the recovery is delayed, and there might be some postictal headache, confusion, drowsiness, limb weakness. And in case of vertebrobasilar ischemia, it usually happens when you raise the arms above the head, and it may precipitate the collapse by subclavian steal phenomenon. In case of hypoglycemia, so that's all for today's session. If you like our video, so you subscribe our channel, and you can follow our page on Facebook, that is www.facebook.com/basiscare. So stay safe, stay healthy. Thank you all.